Hey everyone, and welcome to this explainer. Today, we're diving into something that sounds almost like sci-fi, but is actually rooted in rigorous medical genetics and psychiatry. We're going to be exploring creatine, a new hope for patients with neuropsychiatric disorders, a really fascinating paper by Professor Ahmad Seton, professor of medical genetics. We're looking at a concept that absolutely feels like a massive breakthrough. This analysis highlights the vital need for new therapeutic avenues, and we'll specifically be focusing on creatine's positive role in helping patients with depression, trauma, psychotic conditions, and even neurodevelopmental variations like autism.
So here's the question that might just completely flip everything you thought you knew on its head. Can a famous gym supplement actually treat depression and PTSD? I mean, we all know creatine, right? It's that giant tub of white powder sitting on the counter of pretty much every fitness enthusiast, famous for building muscle and boosting athletic performance. But recent research is pivoting sharply away from the weight room and looking directly at the brain. What if the very same biological mechanism that powers a heavy deadlift could also be used to rescue a brain struggling with severe, treatment-resistant depression?
All right, let's get into it. Section 1. More than muscle, beyond the gym.
Okay, let's dive right into this and look at the actual mechanics of this molecule. Because to really understand how creatine impacts mental health, we kind of have to completely separate it from its reputation as just a bodybuilding tool and look at what it does on a microscopic level inside our cells. At its core, creatine is just a naturally occurring organic compound. Your body actually makes about half of what it needs in the liver and kidneys, and you get the rest from your diet, mostly from meat and fish. Its primary job? Helping to recycle ATP, which is the fundamental energy currency of our cells. You can basically think of creatine as a cellular battery. It acts as a spatial and temporal energy buffer. It stores cellular energy in high-energy chemical bonds and then shuttles that power directly to areas of high demand. For the longest time, we thought of high demand as just, flexing a bicep. But as it turns out, the absolute most energy-hungry organ in your entire body is sitting right inside your skull.
So here is exactly how oral supplementation actually works when we take it for the brain. First, it successfully crosses the blood-brain barrier, and once it's inside the central nervous system, it gets right to work buffering that ATP cellular energy, making sure that neurons have a really stable power supply even when they're highly stressed out. But here's the fascinating part. By stabilizing that energy, it acts as a neuromodulator. Research shows it boosts BDNF, that's brain-derived neurotrophic factor, which is this absolutely crucial protein that helps neurons grow and form new connections. It also influences the secretion of neurotransmitters like serotonin and dopamine. It's essentially setting the optimal biochemical stage for the brain to heal and adapt.
Moving on to Section 2, the brain energy deficit, a cellular battery. To really grasp why this matters for mental health, we have to transition to the core underlying problem here. We are witnessing a massive paradigm shift in psychiatry right now, moving away from just looking at chemical imbalances to understanding mental health through the lens of cellular energy. And this brings us to a really critical concept: cerebral bioenergetic failure. This is basically a state characterized by reduced ATP production and impaired mitochondrial function in the brain. And a growing body of literature is suggesting that major depressive disorder is increasingly characterized by this exact state. Basically, the brain's cellular battery is just running out of juice. When a person is under immense psychological stress, the brain demands enormous amounts of energy. If the mitochondria can't keep up with that demand, the system starts to fail. And this is exactly why interventions known to boost cellular energy production, like creatine, are suddenly stepping into the spotlight as potential lifesavers.
And honestly, the epidemiological data backing this up is just striking. An analysis of over 22,000 participants from the massive NHANES study found that individuals with the highest dietary creatine intake had a 31% lower odds of experiencing depression compared to those with the lowest intake. 31%! And this inverse association was particularly strong among women and younger adults. It's a really powerful observational link that tells us dietary energy availability plays a massive role in our baseline mood and resilience.
Which brings us to Section 3, creatine and depression, accelerating relief.
Now, what's really interesting is how we translate that population data into actual clinical applications for major depressive disorder. Because we aren't just talking about prevention here. We're talking about accelerating relief for people who are actively suffering right now. Let's unpack the clinical trial data. Studies testing about 5 grams of creatine a day alongside standard treatments have shown remarkable benefits. First off, it actually speeds up the response time of SSRI antidepressants. Second, it significantly reduces depression scores in patients who were previously resistant to SSRIs, and this is particularly notable in studies involving female adolescents and adult women. Third, an 8-week pilot study showed it's a highly effective and safe adjunct to cognitive behavioral therapy, literally producing greater reductions in depression scores than CBT alone. By providing the actual literal energy required for synaptogenesis, which is the creation of new neural pathways, creatine acts as the fuel that allows therapies and medications to actually do their job.
Just look at this quote straight from the clinical literature. Creatine has been shown to lead to an earlier treatment response in patients treated with escitalopram as early as 2 weeks. You guys, for patients suffering from treatment-resistant depression, waiting 4 to 8 long weeks for an antidepressant to kick in can be absolute agony. Finding significant relief weeks earlier? That isn't just a neat statistical victory. For these patients, it is absolutely life-changing.
Section 4. PTSD and anxiety, restoring resilience.
But the implications go way beyond just depression. Let's expand the scope of this explainer and look at how this bioenergetic approach applies to trauma and anxiety disorders. Neuroimaging studies using magnetic resonance spectroscopy have actually allowed us to look directly into the living, working brain. And what they found is that lower brain creatine levels are directly linked to more severe symptoms in other conditions too. For instance, in patients with generalized anxiety disorder and social anxiety, lower creatine concentrations in the prefrontal cortex correlate with more severe avoidance and fear. Similarly, in PTSD patients, lower creatine in the anterior cingulate cortex is associated with heightened hyperarousal. Furthermore, emerging research is even exploring its positive role in helping autistic cases, as bioenergetic regulation appears to be absolutely crucial across a wide spectrum of neurodevelopmental and psychiatric conditions. The brain simply doesn't have the metabolic resources to regulate these complex processes.
So this naturally led researchers to test creatine supplementation on trauma. And in one pilot study involving treatment-resistant PTSD patients, including a 52-year-old survivor of a terror bombing who actually hadn't responded to standard psychotherapy, the results were incredibly hopeful. Adding just 5 grams of creatine a day led to improved sleep patterns, significantly reduced trauma intrusiveness, enhanced overall mood, and a reported 30% increase in their overall quality of life. By replenishing the brain's energy buffer, they seemingly restored the brain's capacity to process and recover from extreme stress.
Let's look at Section 5. Crucial risks and interactions, navigating the nuance.
So, here is the really crucial point we have to make. While the data is super promising, creatine is an adjunctive treatment. It's not some magic cure-all, and it absolutely requires careful medical navigation. We need to responsibly address the nuance and the specific medical risks here, particularly when we're dealing with complex psychiatric diagnoses. There is a very stark contrast in clinical recommendations. For major depressive disorder and PTSD, creatine is shaping up to be a highly beneficial adjunct, but for bipolar disorder, it's a completely different story. Because creatine aggressively alters brain energy metabolism and increases neural excitability, it carries a severe risk of triggering what's called a manic switch or manic flip in bipolar patients. So while a few proof-of-concept trials showed it might help bipolar depression, the risk of inducing mania means it should absolutely be avoided or only used under extreme, close psychiatric supervision. Similarly, for psychotic conditions like schizophrenia, trials have generally shown a lack of efficacy for standard symptoms, though some pilot studies are starting to explore its use for negative symptoms. The key takeaway here is that neurochemistry is incredibly delicate.
We also have to deliberately consider how creatine interacts with standard psychiatric medications. With SSRIs and cognitive behavioral therapy, the interaction is totally synergistic. It basically acts as a fuel that speeds up recovery. But with a mood stabilizer like lithium, it's tricky. Both substances are cleared by the kidneys and affect water balance, creating a real risk of renal stress and potential lithium toxicity. Kidney function just has to be strictly monitored. Interestingly, the anticonvulsant valproate can actually inhibit the body's natural creatine transporters. This means a patient on valproate might actually require higher doses of supplemental creatine just to overcome that inhibition and maintain normal brain levels. This right here is exactly why a doctor absolutely must always be involved.
Finally, Section 6, the future of psychiatry, metabolic health. And this brilliantly illustrates exactly why the medical community is so incredibly fascinated right now. We are moving toward a highly nuanced, metabolic understanding of mental health, where we treat the brain not just as a chemical soup, but as an electrical and energetic organ. To summarize the main takeaways from the source data, the promise of creatine is uniquely compelling. It's inexpensive, it's widely available, and it boasts a highly established safety profile thanks to decades of sports science research. But much more importantly, it allows clinicians to directly treat the bioenergetic deficits that we now know underlie so many treatment-resistant conditions. It's really acting as a pioneer compound in the emerging field of metabolic psychiatry, representing a massive leap forward in how we treat the muscle-brain axis.
I want to leave you with this final provocative thought. We've spent decades trying to tweak the brain's neurotransmitters to fight depression and trauma. But if conditions like depression are actually a symptom of the brain's cellular batteries running dry, if healing the mind fundamentally requires fueling the cell, are we finally entering the revolutionary era of metabolic psychiatry? The data strongly suggests we just might be. Thanks so much for joining me for this explainer, and keep your curiosity fueled.